Each of us is craving for the normality that used to govern our lives, yet what many of us are either refusing to accept or simply ignoring is that the world will never be the same. Every country needs to flatten the curve, impose social distancing to slow the spread of the virus so that the number of people sick at once doesn't cause the healthcare system to collapse, as it is threatening to do in Italy right now. This goes to show that the coronavirus pandemic should go on longer, but at a controlled level until herd immunity will be reached if the concept of years-lasting immunity is valid, which is not a known fact, or until we'll all have access to an efficient cure like a vaccine. We need to understand that even if only one person is still infected somewhere in the world, the potential of breakouts is and will continue to represent a reality. According to several reports, the Imperial College in London stated that a good approach would be to intensify social distancing mechanisms wherever the intensive care units are overwhelmed with admissions and lower them when admission rates fall down. Here's a graph that shows you this. The number of admissions in intensive care units is represented by the orange line. Wherever there is a rise above a certain threshold, like for instance 100 each week, the government should move to closing all school facilities and most universities, and of course impose intense social distancing. When the rate of ICU, intensive care units, admissions drop under 50, these measures would be more relaxed. However, anybody having any type of symptoms would still have to remain in home isolation. So what does social distancing really mean? Experts say that it represents reducing the amount of contact happening outside of your house, school, or workplace by 75%. This leads to the understanding that everybody has to minimize as much as possible any type of social contact. So this doesn't allow you to go out as you used to, once a week instead of 4 times a week. Keeping in mind this approach, many researchers agreed that social distancing and closing schools are measures that should be applied 2 or even 3/3 of the time. In other words, this should happen on a pattern of 2 months on and 1 month off until we will have access to a vaccine. At least 18 months or even more is thought to pass until such a cure would be available, and if it would actually work at all. What most reports state is that the outcomes are qualitatively similar for the US. So if this pattern of fighting against a possible pandemic is applied, on a short term, there will be extremely damaging effects on those types of businesses that rely on gatherings of people, such as bars, restaurants, gyms, museums, hotels, theaters, cinemas, art galleries, festival events, shopping malls, sporting events, conference venues, cruise lines, airlines, public transportation, private schools, and daycare centers. This imbalance in the flow of productivity will affect many businesses, and at some point, managers and CEOs will find themselves trapped, having no idea how to handle the situation. Is there a way to make a decent living in such a world? Improved healthcare systems would be an answer. We would have specialized units where any types of pandemics would be dealt with quickly and effectively so that the outbreaks can be controlled and prevented. Also, the production of medical equipment, testing kits, and medication would boost so that future possible pandemics will be better handled than the way things happened with COVID-19. As far as socializing is concerned, people might struggle with some changes. This might mean that cinemas, for example, would reduce their number of seats, any meetings and conferences would be organized in larger spaces, and even gyms would turn to booking your workouts in time so they avoid too much people in the same space at the same time. There are countries that have already tapped into this reality, like Israel. Here, the government is using the mobile phone location data that was previously used only to track terrorists. Now, this method is used for citizens in order to control and stay updated with any possible contact with a person that might be infected. Singapore is another example. Here, authorities turn to contact tracing, and each time it's necessary, citizens are updated with information regarding any new infected person without giving away the patient's identity. Nobody can tell for sure how the future world will look like, but we can imagine it. For instance, maybe you'll need to approve a service on your mobile phone that gives authorities access to all of your movements whenever you'll need to take a flight. Your destination would not be revealed, but the airline would know whenever you'd be near an infected person or any area where disease rates are higher. Also, access to any big events, government buildings, or public transportation hubs would be made by going through a scanner, so that your temperature or other vital signs would be registered. And the same could happen in your workplace, where you'd have to carry with you a monitor that shows your temperature or the state of your other vital signs. Those places that until now used to ask for your age will now maybe ask for your immunity proof as well. We might have to wear a type of immunity card with us to have an evidence of how healthy we are, and that we've either healed from any disease or that our vaccines are up to date. No matter what measures authorities will impose, we will most certainly adapt, exactly how we did when terrorist attacks made airports increase their security with screenings and all of that. In actuality, the fact that our privacy will be monitored so invasively will represent just a bargain for having the liberty to interact with other human beings. Yet, those that will suffer the most are the poor and weak individuals, those that don't have enough access to a decent healthcare system, or those who live their lives in poorer areas that are eligible for any type of disease crisis will become even more constrained in terms of not being able to go to places or use opportunities that others can. Freelance workers, such as those who rely on gigs, taxi drivers or plumbers, will face more challenges as their working systems will become more and more uncertain. The same uncertainty goes for immigrants, refugees, and ex-convicts who will have to deal with the adversities of finding their place in a community. Throughout history, the human race has gone through numerous changes, and each time, people adapted. After this crisis will come to an end, we will have to build a new lifestyle, new working strategies, and new ways of socializing. Yet, we are strong and built to successfully deal with changes. We just have to remain positive and have faith that any change can bring more possibilities for our lives. Remember that the greatest discovery of all time is that a person can change his future by merely changing his attitude. Oprah Winfrey.